Hi everybody, it's Ajanette and I am here to talk to you about sexually transmitted infections. We talk about STIs instead of STDs that we formerly referenced because STIs are sexually transmitted infections kind of reflects that period of time when you might have it, but it hasn't really resulted or culminated in a disease. So you still might be contagious. So we'll talk about that. But STIs are infections that can be transmitted via sexual contact. More than half of the people in the U.S. will actually have an STI once in their lifetime. There's about 3 million chlamydia cases per year, which is the most common STI in the U.S. About almost 1 million gonorrhea cases, and about 1 in 6 Americans have herpes simplex virus 2, which is genital herpes. Now, we don't see a rise in HIV rates. They are remaining pretty stable, but still a significant amount of people contracting HIV every year, with the greatest vulnerability in IV drug users and kind of risky sexual behavior. In terms of like knowledge of STIs, interestingly enough, a survey of college students has shown that about 1 in 6 Americans are infected with herpes simplex, but college students don't know a lot about it. They know a lot about HIV, but not the other more common disorders. I think I was supposed to remove that 1 in 6 Americans line, but I'll take care of that later. Anyway, 6 million new cases of HPV happen per year, which is more than syphilis, herpes, and HIV combined. It is the most common STI really around the world, and we need to be more informed about it. And understand that, you know, about 50% of college students are infected even if they don't know about it. So it's important to spread awareness about it. We do have vaccines out, and it's important to consider for your own children, yourself, if you're still in that age range. I think it's below 26 you're able to get a vaccine. So talk to your gynecologist and your doctor about it. Set up an appointment if you haven't had an annual exam. Set up an appointment. This is for women and men. And so I think it's important if you're a transgender individual or you have a non-binary identity, you should consider it as well. And that's important to note because, your genetic and hormonal reactions may differ. And so some vaccines are made specifically, and this one was designed specifically for females, but they did start administering it to males. So just make sure you talk to your doctor and healthcare provider, particularly if there's any hormone therapy involved, to see how it might influence the vaccine. But ultimately, everyone should be getting the HPV vaccine. HIV, although there's a lot of focus and awareness on it, it is stable. So it's not increasing at significant rates. Definitely something we need to not lose sight of and continue to focus on. But there's definitely a need for added education in terms of HPV. So when we talk about sexually transmitted infections, we used to call them STDs or venereal diseases, but you can become infected before you actually have the disease. Like, let's say, for example, HPV, it's an infection, it's a virus in your system. It may or may not lead to the disease like genital warts or cancers, but it is in fact an infection. And so you might not have any symptoms, but it is present and you can transmit it. So HPV or all STIs are transmitted through vaginal, oral, or anal contact, and that's really important to recognize because we can get STIs through oral sex as well, and most people don't realize that or take precautions. Some of them can spread through a non-sexual contact, blood transmission, sharing needles, things of that nature. Some can actually transmit through clothing or hard surfaces that are shared, or bedding or moist towels or things of that nature. Most STIs, and this is so important, they don't have symptoms. They're what we call asymptomatic. Not everybody has symptoms. And so you think you're safe, but you may not be. But if left untreated, they can be damaging. In fact, 15 to 30% of infertility is linked back to sexually transmitted infections. So why do we see it so common? First of all, young people are having more and more sex, not always using condoms. Second of all, if they have contraception that we studied in previous chapters, that does not protect against sexually transmitted infections. Most people, when they eliminate the risk of pregnancy, they don't think about also eliminating the risk of disease. Most people are asymptomatic, and because they don't have symptoms, they're transmitting the infections. Additionally, when you have sex early in life or have sex with multiple partners throughout life, we're not here to slut shame you, but we are here to tell you to be safe, because that does increase your risk. If you're drinking or using drugs, you're less likely to use safe sex practices. You're more likely to engage in risky sexual behavior. So it's important that you be aware of that. And additionally, sometimes because we know that we have medications or even vaccines, we think that it's not as pressing or urgent, when in fact it is. So we're going to talk about different categories of STIs, and the first we're going to talk about is bacterial. Bacterial sexually transmitted infections come from the microorganisms that are in fact bacteria: gonorrhea, syphilis, chlamydia, vaginosis, candidiasis, candida, and trichomoniasis are the most commonly talked about. Gonorrhea, back in the day, even before my day, it was called the clap or the drip. It used to be the most common. Now chlamydia is. 22% was the infection rate between 2000 and 2010, with over 500,000 new cases in a year, most commonly between the ages of 20 and 24. It's caused by a bacteria. There's a discharge and a burning when you go to the bathroom, when you urinate, and it can lead to pelvic inflammatory disease and even infertility if it's not treated. So men usually have the penile discharge. Their urethra can get red, irritated, inflamed, and there can be burning when you pee or urinate. You can have 2 to 5 days of kind of no symptoms after you've been exposed, and then the symptoms appear 2 to 5 days after having sex and being exposed. It can lead to the inflammation of the epididymis, and it can also lead to infertility. For females, it can cause your cervix to be inflamed. Also, there can be discharge. 80% of females have 0 symptoms. And it also can lead to infertility and pelvic inflammatory disease, which leads to, that should say, cramps, pain, tenderness, and discharge. So just a couple images. Now, gonorrhea can be transmitted through unprotected sex. It needs the warm, moist environment, so eyes can actually pick up gonorrhea. It's highly contagious. And you only need 1 single exposure. So half of the women exposed actually contract it, and 1/4 of the men. You can also get pharyngeal gonorrhea, and babies can get it in their eyes. So what we do is, it involves a physical exam, and then antibiotics are the standard way to treat it. All your sex partners should be examined and treated, otherwise it gets passed back and forth. Syphilis is another bacterial infection. It is actually a spiral-shaped bacteria. It also can be treated with a penicillin. We see it most commonly in southern states, Washington, California, DC, and New York. largely because of the population, that is in those areas. It also can be asymptomatic and have negligible consequences, but it can be lethal. If you left it untreated, it can lead to heart disease, blindness, confusion, and even death. The history is that Christopher Columbus actually brought it back after his travels. So syphilis goes through stages. In the primary stage, you have a very painful sore, a lesion that comes up about 2 to 4 weeks after you've had sexual contact. For women, it often is in their vaginal walls or even their cervix or maybe in their labia. For men, it's often on the glands, the scrotum, or the shaft. It's more visible in men, so it's more obvious to men. It can appear in your mouth and oral area as well. You can also develop sores in the rectum if you've engaged in anal sex or any kind of anal contact during sex. Secondary stage is a few weeks to a few months after you start to develop the sores. You develop a skin rash. It's painless quite often. These raised red bumps, but they can be oozing a discharge. And you can also develop sores and painful swelling of the joints, get a sore throat, have headaches and fever. Symptoms usually disappear. So here's what some of those might look like. Then you move on to the latent stage where it lies dormant for up to 40 years. And it can continue to infect your circulatory and central nervous system and your bones. So you may no longer be contagious with sexual partners, but it's still problematic. Pregnant women can pass it on to babies. And in the tertiary stage, you might have a large ulcer that forms on the skin, even in the organs. It can be a very destructive ulcer, and it can lead to cardiovascular or central nervous system challenges. It can be fatal. Neurosyphilis can cause brain damage, so it's really important to get it treated. Transmission is most often through unprotected sex. You can contact one of the sores and get it as well. And again, through pregnancy and delivery, you can get it. The baby can get it. So again, a physical exam, and then there's a blood test that can be done, and it can be treated with antibiotics. Chlamydia is more common than gonorrhea and syphilis. It often co-occurs with other STIs. It is also caused by a specific bacteria. They're actually parasites that survive within the cell for this one. And it can be associated with different types of infections. About 1 to 1.5 million reported, but the CDC estimates that about 3 million cases occur each year because a lot of them go unreported. Highest among female teenagers and college students. Females are more vulnerable to STIs. They're the recipients of STIs more easily than males. So, chlamydia also can have similar symptoms to gonorrhea. It can lead to inflammation of the urethra and can have painful burning during urination. And women can also have their urethra and their cervix gets irritated, pelvic inflammatory disease if left untreated. About 25% of men and 70% of women have 0 symptoms, so keep that in mind. Again, it can be transmitted through intercourse, contact with the eye, oral sex, and during birth. We do cervical smears, send those in and test them and culture them, and then antibiotics are the treatment. Again, your sex partners need to be treated. Some other bacterial infections that are less common is the chancroid, shigellosis, granuloma inguinal. This is actually in the groin area. It can be more painful and can actually lead to holes in the bladder and rectum, so important to take care of it. Lymphogranuloma venereum, which is Also, bacteria goes in through the penis or vulva and has small sores. Can also affect the lymph nodes, have flu-like symptoms, and again, something we could all treat with, antibiotics. So vaginitis, inflammation of the vagina, there's a series of, this is like a larger umbrella term, and a series of conditions underneath it, including bacterial vaginosis, a yeast infection, and trichomoniasis. So looking at each of those individually, bacterial vaginosis is often caused by the specific bacteria, transmitted sexually primarily. It has a very strong odorous discharge. You need to culture that discharge and see if in fact it is vaginosis. Again, there's topical drugs and oral medication to treat it. Candidiasis is a fungus. It's yeast. It's also thrush, and you can see it in the mouth in babies. Women are vulnerable to yeast infections because yeast thrives in moist areas, which is consistent with the vaginal environment. So when you have that soreness, itching, inflammation, and sometimes a white, thick, or kind of curd-like discharge, that might be an indication that you have a yeast infection. Can occur in the mouth, the penis. It's really important to wash your clothes with vinegar in addition to being treated. You can become more vulnerable if you're taking antibiotics. It kind of creates an environment that's prone to yeast infections. If you're on birth control, have an IUD, or diabetes that kind of adjusts your flora, your vaginal flora. High sugar diets, the yeast feeds on sugar, so that actually contributes to it. So eating yogurt and active bacteria helps. Men typically can't have no symptoms, but they can in fact get it, so problematic. Trichomoniasis is the most common STI. It's caused by a parasite, about 7.5 million cases per year. There's burning, itching, urination problems. Sometimes you have pain during sex. It also has a whitish, yellowish, or green discharge, sometimes foamy. Women can also get lower abdominal pain, and during your period, it may in fact hurt worse. So it's almost always sexually transmitted, but you can in fact contract it through touching infected objects. So let's move on to some viral STIs. So viruses are particles in, they have DNA coating on them, and they infect cells directly. And so every time the cell reproduces, it reproduces new viruses as well. Okay, everybody, back to viral STIs. So there are 3 main types of viral STIs: HIV, herpes, and HPV, human papillomavirus. That happens to be the most common STI in the whole world, is HPV. So important that we raise awareness about it. Let's start with HIV, which we've done a really good public awareness effort toward raising awareness about HIV and educating the world, not just the US, but the world, about HIV. It's a sexually transmitted virus, and what it does is it breaks down the white blood cell and the immune system. And so you often don't die of HIV, you die because your immune system is compromised and you're exposed to other pathogens or illnesses that your body cannot fight. So HIV is carried in your blood system, and AIDS can be the resulting disease that actually is caused by the HIV, where your immune system is so broken down that now you are at the point where you're vulnerable and potentially terminal and at risk of death because you do not have an immune system that can protect you. And so about 1.2 million Americans live with HIV, and we have had about 500,000 or 500,000 die from HIV. We do see it disproportionately impacts people of color, IV drug users, and people who engage in unprotected sex. We obviously can't change our ethnicity, right? But we can be safe and responsible about drug use. I know that seems counterintuitive, but it is. And we can have protected sex. So it's important to note that we often associate this as a man's disease, and it's not. Women are affected. In fact, it's growing among heterosexual women. And so, although we have predominantly seen rises in homosexual men and IV drug users, you need to be aware that the people most vulnerable are heterosexual couples these days. And so we have to be safe and cautious. Additionally, when we talk about the immune system, right, leukocytes are heavily involved in HIV. They actually kill pathogens, and and they're able to recognize the pathogen through fragments known as antigens. So what happens is when your immune system identifies a pathogen, it starts to trigger the immune response, which includes inflammation, and then it discharges like an army of leukocytes to the region. And what happens is those HIV cells bind on to those immune system cells, and it uses them to copy itself, and so it can start to invade our entire system. In the process, it destroys CD4 cells, which are a type of leukocyte, and it also signals B cells and killer T cells to come in and defend the body. And so eventually your CD4 cells decline so badly that you're vulnerable to other infections that can kill you. So here we see a microscopic image of one of those HIV viruses attacking a healthy cell and therefore making it vulnerable to infection. When you're first diagnosed with HIV, you might have some flu-like symptoms, and you should note that most people don't have any symptoms at all. They might have lymph nodes that are swollen. Maybe they lose weight here and there, and fever, fatigue, diarrhea consistent with those flu symptoms. It is the 50% of people who have HIV do develop AIDS within 10 years. But there are medications. If you are fortunate enough to be able to afford them, then those antivirals can help to prolong the point at which HIV becomes AIDS, if at all. And, once you have AIDS, your body kind of wastes away, and then you are vulnerable to other diseases, as noted. So, HIV is transmitted through your bodily fluids. There isn't any research to suggest that there's any kind of transmittable level in your saliva, so it's not necessarily transmitted through kissing, but any other exchange of bodily fluids, including breastfeeding, can pass on that virus. And whether that's through oral, anal sex, if you're having interactions with an infected partner, it can be problematic. So this can also be exchanged when we are sharing needles together, if we're using drugs together. Sometimes if you've had a transfusion, they do test blood. So it's very rare that you're going to receive contaminated blood, but it is possible. If you have any kind of organ or tissue transplant with HIV, that also makes you vulnerable. That typically, though, will disqualify you from donating, but that's something that, the transplant agencies have to decide. If you have any kind of infected semen through artificial insemination, they can pass on the HIV as well. Sometimes if you're accidentally struck with a needle that has been used to treat a person with HIV, that can also pass on the virus. So if you do have any kind of cuts, sores, or even the very thin mucus lining of the vagina, rectum, or mouth, it makes you more vulnerable. And so anyway, it's important to note that it's easier for a man to transmit it to a woman than it is a woman to transmit it to a man. Obviously, the vagina has more surface area and therefore is more vulnerable to receiving HIV than the area that the penis is exposed to, right? So, risk factors for transmission. Of course, the number of contacts, the more you have sex with an infected person, the greater the risk. There are medications that your partner can take to reduce the transmission. Any kind of rape or anal sex where there's tearing or there's any kind of cuts in the skin, that creates a passageway for the HIV. The viral load in the semen is higher slightly after infection, so those are higher risk periods. And then if you have any kind of STI, that makes you more vulnerable. Any kind of ulcers in the vagina related to syphilis or herpes are problematic. Circumcised men have a lower risk of transmitting HPV and herpes, as well as HIV. And then genetics seem to play a role for some individuals in areas of Western Europe. So donating blood is not going to give you HIV. Casual contact, so touching someone or money exchanges at the store, insect bites, airborne germs, any kind of food, sharing food, that's not going to necessarily transmit HIV. You are diagnosed through a blood test. They look for the antibodies, and they can do that. It's most often through your blood, but it can be done through saliva or urine sample. Or a quick is an antibody test that you can do that gives you pretty quick results. A positive, seropositive test means the antibodies were found. Negative means they weren't. You do a mouth swab. You can do at-home tests where you swab your mouth and send it in. Prevention is our best option, where we really have developed, it's not widespread, but we don't have an effective vaccine as of yet, but we have a couple of patients where we've shown an effective treatment, and so more to come on that in the next 5 to 10 years. Additionally, antiretroviral therapy is again expensive, but it is available to decrease the likelihood that HIV is going to progress into AIDS. Unfortunately, poor individuals who might be at greater risk are not able to afford these drugs. And they do come with side effects, as do most medications, and they're something you really have to take for the rest of your life. We're worried that HIV might mutate and become resistant to those drugs over time. So let's talk a little bit about genital herpes. The herpes simplex virus, or HSV2, is in fact genital herpes. There is cold sores, which are oral herpes. They are cousins and related to one another. You can transfer oral herpes to the genital area and vice versa. But cold sores can be transmitted without any kind of sexual contact. 1 in 6 Americans is infected with herpes simplex virus, and they do result in kind of sores and blisters around the genital area. You can get fever blisters and cold sores if you have herpes simplex 1, that's around the mouth. Again, you can infect the genital area with HSV1 if in fact you're coming in contact with other areas. So it stays with you forever, increases your risk of miscarriage. When you're having an outbreak is when you're most likely to transmit it. Any kind of intercourse or sexual contact can transfer the virus. It can also survive on toilet seats or other objects. It's really important you don't touch the blisters or the outbreaks at all. You wash your hands, don't share towels, and don't engage in any kind of touching with the other person, so that you can be mindful not to pass it. Symptoms include the lesions or sores. They can last for about 6 to 8 days. They're a little red, uncomfortable. They may actually spread into the thighs, buttocks, vagina, or cervix areas. Those blisters have fluid in them, and within the fluid is the virus itself. The immune system attacks it, and consequently it fills with pus, right? And sometimes that bursts. They're painful. It's uncomfortable. So those little ulcers have a red ring, and they're sore and tender. If you have it in the genital area, it can cause headaches, muscle aches, swollen lymph glands, fever, burning when you go to the bathroom, and vaginal discharge. Those blisters crust over and heal in about 1 to 3 weeks. If they're internal, that takes a little bit longer. Women should not have sex for at least 10 days after they've had their sores have healed. And you're more vulnerable when you're under a lot of stress, or you're sick and have a cold or something of that nature. Genital herpes is usually diagnosed by the doctor. They do a physical exam. They might swab the blisters themselves, get that fluid, and send it in for a test. We don't have vaccines for it, unfortunately. Viruses are not treatable with antibiotics, and we don't have like antiviral drugs that can necessarily kill it. They might help with some symptoms, speed up the healing, but they don't kill the virus throughout your system. So we're still yet to deal with that. There are some oral pills that you can take for internal lesions. Some people develop a tolerance, so they no longer are healthy. Yes, it's frustrating. It can be stressful when you have an outbreak, but you learn to cope. So here's what a lesion might look like on a penis. I think we talked about HPV already, but let's go back. It's the most common STI. You have about half of all adult women in some countries. 50% of sexually active college women in the U.S. are expected to be infected. This largely focuses on women because men are not often tested. They're often asymptomatic. Women are also more vulnerable because the cells of the cervix divide quickly, and so the HPV then is able to replicate quickly in those host cells. If you become sexually active before 18, have lots of partners, then that increases your risk. Nearly half of all sexually active teens are suspected to have HPV. It often clears itself up in about 2 years for about 90% of the cases, but it can lead to genital warts, and it actually is linked to the majority of cervical cancers and vaginal vulvar cancers as well. Circumcised men are less likely to have it, and it can be transmitted through any kind of sexual contact, also through towels or clothing. So it's important to be careful about not sharing those things either. Genital warts is a disease that might emerge from the infection. The warts are caused by HPV. They're visible in areas of the skin. They often appear in the cervix or the urethra where they're not visible. And it's most common among young people. The warts can occur in genital, anal regions, kind of cauliflower in nature. They can be itchy, hard yellow or gray in color, and you freeze them off. Cryotherapy. there's a liquid nitrogen that is dropped onto them, and it kind of, it burns them off, really. Talk about freezing, but it's kind of a freezer burn, if you're familiar with that kind of experience or discomfort. There's also, you know, an alcohol that you can use to dry them up, and they fall off. And when you have women who are pregnant, or for cervical treatment, they might use that as well. Even though you're treating the warts, the HPV is still present in the body. There are vaccines to prevent HPV. Gardasil, they use it for teens right now, specifically when you're under 12. However, that's when they target you for it. You can take it up until you're 26 years of age. So for those of you in the class who have not had the HPV vaccine, I recommend you go to your doctor and get it. They're also showing that it's protecting men from genital warts and anal cancer as well. So important. And then moving on to hepatitis. Hepatitis is inflammation of the liver. Itis is always inflammation, and hepa is referencing the liver. Individuals may become jaundice. Our liver filters out the bile from our system. When it's not able to do that, our skin becomes yellow, the whites of our eyes become yellow, and we might lose our appetite, be nauseous. There's 4 different types of hepatitis. Each is diagnosed through a blood test. If you're having an hepatitis flare-up, you might have to drink lots of fluids and be recommended for bed, just bed rest, just rest. So hepatitis A is when you are when you are contacting any kind of fecal matter that contains the virus. There's also a shellfish that you can get it from. So restaurant employees are supposed to wash their hands thoroughly because of this. Hepatitis B is associated with chronic liver disease. So it actually is most likely to kill you. And it's transmitted through a number of ways, but mostly exchange of bodily fluids. Hepatitis C is more mild. It also can be chronic and result in cancer or cirrhosis. And then Hep D is only present when you have Hep B, similar symptoms, and it also negatively affects the liver. Obviously, they all do, right? Zika, we heard about, it's causes us to be afraid of mosquito bites, right? The virus can spread through a mosquito biting an infected person and then a mosquito biting you. But it can also be spread through sexual contact. You can pass it on to your baby if you're pregnant, and it specifically puts the baby at risk of microcephaly, so their head does not reach normal size and fully develop. You can get it through a blood transfusion. There's certain countries where it's more active, or territories, but most people are asymptomatic. But when you are, fever, joint pain, rash, red eyes, and it stays in your blood for about a week. So try not to interact or have any sexual interactions with a person that's traveled to that area for at least a week after they come home. Molluscum contagiosum is red lesions on the genitals, buttocks, thighs, and abdomen. It's a pox virus similar to like chicken pox. You get this rash about 2 to 3 months after infection, lasts about 6 months, and you can pop these like a blackhead. That inner core contains the virus, so that can actually help them heal, but you can also be treated with various other substances. And finally, there's ectoparasitic infestations, ecto meaning outside, so they're parasites that live outside the body, and they suck the life out of you, essentially. So crabs or pubic lice is one, and then scabies is the other. Scabies burrow under your skin. Crabs stay kind of on the surface, both of which are kind of related to their insects, right? Crabs can be seen by the naked eye. They spread sexually also through bedding and towels and toilet seats. They need a host cell, so they can only survive without a host for about 24 hours. They might have laid eggs in a moist towel, Those hatch in about 7 days, so if you're not washing your towels, you can be passing it on. They can spread to, similar to lice in your hair, they can spread to your head as well. They can be itchy because they're literally poking your skin and taking out blood. They're sucking blood out of you. So they can live for about a month. However, because they hatch eggs constantly, it can go on and on and on. So similar to lice, we do head lice. There's a treatment, a chemical that kills them off and kills the eggs, and you have to scrape through the way that you do for head lice. Scabies actually are little mites that dig into your body. They can infest your clothes, your beds, your towels, other fabrics, but they can attach at the base of the pubic hair, and then they burrow into you. They dig into you. They form little canals, and it can be itchy, uncomfortable, painful. You can see them underneath your skin where they burrowed, and so you can get redness and you can get sores and welts. You can't necessarily see them with the naked eye, but you can see the symptoms that they're causing in the skin from their burrowing. And they're often on the hands, the wrists, the genitals, armpits, and feet even. So again, you treat them with the same chemical, and you have to wash the whole, from the neck down, the whole body. So how can we prevent STIs? Well, we can be abstinent, which kind of is like starving or denying ourselves of food and water, and that can be problematic for some of us. So we can enter a monogamous relationship, and we can educate one another and have conversations. If we choose to not be monogamous, we need to be safe with our partners, talk about our sexual history, be sober, so we're making responsible decisions. Making sure you're inspecting yourself for symptoms, inspecting your partner for symptoms, using condoms, using dental dams when you're performing oral sex on a woman, and even condoms when you're performing oral sex on a man. Engaging in like fisting or any kind of anal contact, that's all risky sexual behavior that increases your risk. Wash your genital area before sex and after sex. It helps. Make sure you're seeing your doctor regularly. Get to know your partners before you have sex with them. Now, I'm a total hypochondriac, so if any of you are like that, I will itch and scrape and I will feel, horrible in all the wrong ways. I told my daughter I'm going to have horrible dreams tonight after I have been preparing this lecture and now doing this lecture video. So happy dreams to you. Hopefully you're not a hypochondriac. The main takeaway is to be safe. Take care of you. Be informed. Be educated. Be sexually empowered, but be safe first and foremost. Bye, everyone.